This module will address evidence-based health promotion, disease prevention, and caregiver support programs, an important aspect of systems integration. There are 3 learning objectives for this module: understanding the definitions, terms, and concepts of evidence-based programs, understand which evidence-based programs are being promoted as part of systems integration, understand the relationship between individual evidence-based programs and the broader systems integration initiative, including its overall goal to support quality of life and community living of older adults and people with disabilities. NYSOFA also plays an important role in expanding availability of evidence-based programs by leading the systems integration project and meeting the relevant goals and objectives that address building such capacity. The systems integration goal is to ensure that older adults, individuals with disabilities, and family caregivers have clear and ready access to a sustainable, integrated system that offers a comprehensive set of high-quality, evidence-based services and programs that can help them remain independent and healthy in the community. And among the objectives is one to increase access to a comprehensive set of services, including dementia-capable services, family caregiver support services, health promotion and disease prevention programs, long-term care services and supports, public benefits programs, care transitions services, and related support services. As noted in the objective, advancing dementia capability within the aging network is a key component of systems integration. The State-Level Systems Integration Steering Committee has used federal guidance and directives to develop a draft definition of dementia capability. This is now under review for finalization within the SI Dementia Capable Workgroup. To be dementia capable, staff who help consumers access home and community-based services, HCBS, must be skilled at identifying and effectively communicating with individuals who have or may have dementia, including Alzheimer's disease, and their caregivers, knowledgeable about the kinds of services that help people with dementia and their caregivers, capable of providing linkages to other organizations that can help. This includes helping people with dementia and their caregivers access to evidence-based interventions. This will be addressed further in the Caregiver EBI section. There are a number of national drivers of change in healthcare and long-term services and supports that are encouraging greater use of evidence-based programs. These include the Patient Protection and Affordable Care Act, that is, Affordable Care Act. Some might refer to this legislation as Obamacare. Realigning systems from acute to chronic care, broader emphasis on prevention and chronic care management, support for screenings and other prevention efforts, desired reduction in avoidable readmissions. Overall, there's a desire to help people to live longer in the community, and health promotion, disease prevention, and caregiver support are seen as key tools for helping this to be possible. Let's talk about these in a little more detail. Most of the attention on the Affordable Care Act has been about the expansion of those covered by insurance. This is important, but the Act is also about changing how health care is delivered. The World Health Organization and others have been arguing for some time that we have an acute care health system when we need one more focused on managing chronic health needs. With decreased communicable diseases, rapid population aging, and increased chronic conditions, this means there is a mismatch between health problems and health care. As a result, patients, healthcare workers, and decision-makers are recognizing that effective chronic condition care requires a different kind of healthcare system. In particular, health problems such as diabetes, asthma, heart disease, and depression require extended and regular healthcare contact. Such concerns are also increasing interest in community as well as health system responses. The Affordable Care Act is aimed at driving some of the needed changes, and the AAA and New York Connects networks are already critical community-based partners in moving this change process forward. As part of these changes, there is a drive to develop accountable care organizations, that is, healthcare provider groups, such as hospitals, physicians, and other services, are being asked and encouraged to work together to coordinate patient care with a goal to deliver seamless, well-coordinated care within a patient-centered structure that meets standards of care while reducing cost. AAAs and New York Connects are being called on to help realize that such seamless, well-coordinated care includes care in the community. There is also interest in developing patient-centered medical homes, which will be discussed next in this module. A patient-centered medical home is a team-based healthcare delivery model led by a physician with the goal of obtaining maximum health outcomes. As can be seen in the graphic, comprehensive healthcare management is the foundation for the activities of a patient-centered medical home. Community supports, caregiver services, health promotion, and care transitions are also important contributors to the envisioned, more holistic approach to chronic care management. Turning to the readmissions issue, there is a concern that approximately 20% of older adults discharged from hospitals are readmitted within 30 days. In many cases, these readmissions are unavoidable, but sometimes they are a result of poor coordination between hospitals and transfer to other settings, including their own home. Recent funding from the Centers for Medicaid and Medicare Services has specifically targeted regional collaborations led by community-based organizations to improve transition services to manage Medicare patients' hospital discharges. The community care transitions interventions used by these collaborations must be evidence-based, and their delivery is a component of community engagement by healthcare. Another important aspect of the Affordable Care Act is its support for no copay preventive care. This benefit is already available through Medicare, where no copay screenings and vaccines, including diabetes screenings, and no copay annual wellness visits, which include advice on healthy lifestyle changes, are identifying people who would benefit from wellness and health education, including support for the development of self-management skills. More than 25 million older adults used a no-copay preventive service in 2011, and the number is growing. New York has been very interested in increasing use and availability of a number of EBIs for its residents with or at risk of developing chronic conditions who could benefit from these new approaches. There has been considerable collaboration between the New York State Office for the Aging, the New York State Department of Health, and the University at Albany to build capacity for a menu of evidence-based health promotion and disease prevention programs. NYSOFA has also supported a number of caregiver interventions. Through this collaboration, New York State has been a leader in efforts to build community capacity for delivery of EBIs. More specifically, NYSOFA has leveraged Administration on Aging, Administration for Community Living, ARRA, Prevention and Public Health Fund grants to build capacity for delivery of the Stanford Chronic Disease Self-Management Education programs and embed delivery infrastructure with the area agencies on aging and their partners. The New York State Department of Health has leveraged its funding sources to support these efforts and has also worked to build evidence-based diabetes prevention and physical activity programming, as well as smoking cessation and healthy eating programs using CDC funding. Working with both NYSOFA and the New York State Department of Health, the New York State Quality and Technical Assistance Center at the University at Albany has worked to offer needed trainings and to develop quality assurance, data collection, and technical assistance to support a select group of these programs. On this slide, you can see the capacity that has been created through these efforts just for two of the programs we will describe later: the Chronic Disease Self-Management Program and the Diabetes Self-Management Program. This capacity continues to grow. There are already many AAAs involved in delivering a range of EBIs, including the Chronic Disease Self-Management Program, A Matter of Balance, Care Transitions, and powerful tools for caregivers. Their efforts are part of a larger statewide network of over 75 partners delivering EBIs in 800 sites. Other partners include county departments of health, rural health networks, hospitals, home care agencies, universities, employee assistance programs, Cornell Cooperative Extension, senior centers, senior housing, RSVPs, and YMCAs. Supporting people with chronic conditions and their caregivers has always been of interest to the Aging Network, and Title III-D of the Older Americans Act has supported programs designed to help older adults prevent and/or manage chronic diseases and promote healthier lifestyles. This is also a value because healthy aging reduces healthcare costs and increases quality of life. These programs are important because older Americans are disproportionately affected by chronic disease. Evidence-based interventions, that is, EBIs, are of increasing interest because they empower older adults to take control of their health, mitigate the negative impact of chronic diseases and falls, and reduce use of hospital services and emergency room visits. In this way, evidence-based interventions provide the greatest impact for available Title III-D funding. For these reasons, the Administration on Community Living and NYSOFA are working with aging partners to increase the use of evidence-based interventions. There is growing emphasis on supporting EBIs that meet the highest criteria of evidence in producing demonstrated outcomes. To support the advancement of these interventions, NYSOFA will be requiring all programs funded under 3D to meet the highest level of evidence-based criteria set forth by ACL. Programs that meet highest level criteria are those that have demonstrated through evaluation to be effective for improving the health and well-being or reducing disease, disability, and/or injury among older adults, and proven effective with older adult population using experimental or quasi-experimental design, and research results published in a peer-reviewed journal, and fully translated in one or more community sites, and includes developed dissemination products that are available to the public. Examples include CDSME, Online CDSME, A Matter of Balance, New York University Caregiver Intervention, NYUCI, Resources for Enhancing Alzheimer's Caregiver Health 2, REACH 2, Healthy Ideas, Pearls, Care Transitions. These highest-level criteria interventions are the EBIs that NYSOFA and ACL are most interested in supporting, though there are many other highest-level programs that may be supported with Title III-D. You may be aware of other programs at your agency that most people think are very effective, but may not meet the evidence-based criteria. These are best practices, which are defined as processes, practices, or systems widely recognized as improving the performance and efficiency of organizations in a target area, such as health promotion, and consistent with health promotion and other values, goals, ethics, theories, beliefs, evidence, and with understanding of the environment. They are good, but they may not be evidence-based, and are not supported by the Systems Integration Initiative. Effective April 1, 2015, they can no longer be funded with Older Americans Act Title III-D dollars. However, these good practices programs may be funded with other appropriate funding streams. There are many interventions that we are sure work, but to be evidence-based, we usually expect to see that the efficacy or ability to address the concern it targets has been tested in a randomized controlled trial. In these studies, subjects are randomly assigned to either an intervention or a control condition in an effort to eliminate any bias from unknown characteristics of the sample that might contribute to treatment effects. Random assignment is believed to balance these characteristics evenly across intervention groups. In this way, we can feel better assured that any differences we find are only about the effects of the intervention. However, just because something worked in an experiment does not mean that it will work as well in the real world. For this reason, a whole new branch of research has developed, translational research, which tries to understand what else needs to be done or understood if the evidence-based intervention is going to be used. This research addresses how the intervention needs to be packaged and supported, what will help to get it adopted, and how local issues need to be addressed while assuring that the important core components still get delivered. We know a program is genuinely evidence-based and able to be implemented in community settings when it has a specific target population, a specific measurable goal, a stated reasoning for how it will work, and research-proven benefits, a well-defined program structure and time frame, specified staffing needs and skills, specified facility and equipment needs, and if it builds in program evaluation to measure program quality and outcomes. We are now going to discuss a number of highest criteria EBIs in more detail. The interventions of interest fall into three groupings. Chronic health condition focus. These are educational programs designed to help people develop skills and confidence to manage health conditions. Physical activity focus. These are small groups or self-directed interventions where people learn strategies to increase physical activity safely. And caregiver support, small group and individual interventions to help caregivers better manage stress in caregiving and to better support maintenance in the community of the person cared for. People do not live their lives in healthcare facilities or social service and aging network offices. Self-management interventions recognize this, and they are also of value because they are proven effective in university-based research and affordable. They are also taught by trained and certified instructors and are conveniently held in community settings. The core elements of self-management interventions focus on the person's perceived problem, build self-efficacy, which is the confidence that a person develops when they believe they have the skills needed to manage their perceived problem, are holistic and proactive, and address improving health status, coping skills, and appropriate healthcare utilization. This makes these programs different from the instruction offered in traditional patient education. Self-management education is complementary to traditional patient education. Over the last 8 years, the New York State Office for the Aging has supported building capacity throughout New York State for the Stanford University suite of self-management programs. NYSOVA has partnered with the New York State Department of Health in these efforts. In addition to these chronic disease self-management programs, the New York State Department of Health supports the development of capacity in Active Living Every Day, Walk with Ease, and the CDC National Diabetes Prevention Program. The New York State Quality and Technical Assistance Center at the University at Albany, or QTAC, provides training, technical assistance, and other supports for these programs, and also supports the Active Choices program. Delivery of evidence-based programs such as these may be supported through systems integration efforts and funding. These and some other evidence-based programs targeted at older adults and people who are aging will now be described. As well as the Chronic Disease Self-Management Program, CDSMEs include the Diabetes Self-Management Program, which addresses type 2 diabetes, the Positive Self-Management Program, which targets HIV/AIDS, and a chronic pain self-management version of the program. A Spanish language and cultural version of CDSMP, or DSMP, is offered in several parts of New York State, and there is also the possibility of offering these interventions in several other languages. The QTAC supports statewide delivery of all the CDSMEs described and can help with training, technical assistance, book purchases, etc. If providers are interested, QTAC may also support delivery of the Positive Self-Management Program, which targets HIV/AIDS, and a chronic pain self-management version of the program. QTAC also supports additional materials delivered in a 7th session for people with hypertension. The main self-management program being supported in New York State under CDSME and systems integration is the Chronic Disease Self-Management Program. The program is targeted to adults 18 and over living with one or more chronic conditions and/or providing care to someone living with a chronic condition. Using an evidence-based curriculum developed at Stanford University Patient Education Research Center, lay leaders lead interactive workshops to help participants build confidence in their ability to manage their health conditions. This small group program, facilitated by 2 peer leaders, often with chronic conditions themselves, meets 2.5 hours weekly for 6 weeks in a range of community settings. Groups are usually of 12 to 20 participants, and group members learn about and practice problem-solving, goal-setting, decision-making, overcoming barriers, share progress with the group, and get feedback on challenges. Classes may be offered in both English and Spanish. The program has been reported to have many positive outcomes, including increased physical activity, better coping strategies and system management, improvements in self-rated health, social and role activities, and feelings of more energy and less fatigue.
She came in literally with a helmet on and a back brace and a walker. At the end of the 6 weeks, the helmet was gone, the back brace was gone. She literally forgot her walker, walked over to a chair, sat down so we could take a picture of her, and she was glowing.
I'm able to go to a gym 3 times a week.
Once I'd done it, you got a little confidence, it sort of grows on you.
The fact that it was an empowering tool for people.
We all enjoyed it very much.
It's just an awesome program.
The fact is, it works.
Every day, residents of New York are discovering living healthy programs, and every day, people are taking charge of their health and living their life like they never thought possible.
I've been interested in being healthy, always. After I had been really unhappily sick for a couple of years, I thought, well, this might help get me back. I have osteoporosis, osteoarthritis. I had trouble sleeping. I was very, very sad and depressed, and I was taking medication to help me sleep. And it just was making me crazy, and I didn't know that I would be around the next day. Beginning to think that I was, after all, mortal, it gave me an opportunity to decide what it is that I want to accomplish in the next week or next month or the next year or whatever. And I still use that idea. I make lists of things I want to get accomplished, and I learned how to do that. Another thing that I got was a relationship with a group of people in there. We all wanted to get better health, and we were all willing to do the kinds of things that we learned about in the class. We decided to get together once a month, regularly, as a sort of a reunion. We enjoy each other. There's one lady that's over 90, and she is so active, and I meet her in the supermarket. She drives there by herself. That's really very, very encouraging. It helps put your mind in the right direction. It helps you to think positively, and that's very important, to think positively.
So this is not, going to the moon. This is very hands-on, something you can actually do, and you get a benefit.
It's about giving people the skills they need so that they can take charge of their wellness. The tools in there are not just health management tools, but life skills tools. And it's something that you specifically want to do, not something that somebody else is telling you should do or you've read about. It's you personally are invested in doing this. And then setting up the steps to make that happen and feeling confident that, in fact, you can make it happen.
Anybody who is having problems with anything, if they go to this class and they learn to think positively, they'll come out better for it.
For more information, call 1-877-496-2780 or email qtech@albany.edu. Living healthy every day.
NYSOFA has encouraged and QTAC has supported the development of capacity in the Diabetes Self-Management Program, or DSMP, which utilizes about 50% of the CDSMP content, but also specifically targets type 2 diabetes management concerns and includes content on menu planning, nutrition label reading, managing high-low blood sugars, managing sick days, foot care, testing, and monitoring blood sugar. Among the other interventions supported is Active Living Every Day. Active Living Every Day is a program that responds to the problem that more than 50% of Americans don't get enough physical activity. 32% of adults are obese. 50% of people who start an activity plan drop out within 6 months. Repeated failures at increasing physical activity reduces self-confidence, so the program takes a self-management approach and targets adults over 18 who want to increase their physical activity. They meet in small groups for 1 hour over 12 weeks and work to develop the skills needed to gradually increase physical activity through lifestyle activity and overcome barriers to meeting personal goals. Behavior change models help empower people to overcome barriers to physical activity. The program's philosophy that people are more likely to become and stay active when they learn lifestyle skills based on their current level of readiness to change, that physical activity must become part of lifestyle, and even moderate levels of activity leads to significant health benefits. Under randomized controlled trial and quasi-experimental community-based designed research conditions, there were increases in activity, reductions in body mass index or BMI, and decreases in stress and depressive symptoms. The QTAC supports statewide delivery of Active Living Every Day and can help with training, technical assistance, book purchases, etc. Walk with Ease is a self-guided or directed walking program that targets adults over 18 with arthritis and or other chronic conditions such as diabetes, heart disease, and obesity. It teaches strategies to make physical activity part of everyday life. Basically, level of walking is assessed at a starting point, and people contract with themselves to walk more, keep a walking diary, follow basic warm-up, stretch, cool-down exercises, and assess how they have done after a period such as 6 weeks. Safely increasing walking is stressed throughout the program. The QTAC supports statewide delivery of self-managed Walk with Ease and can help with getting programs started, getting books, etc. Study data shows that the program reduced pain and discomfort of arthritis, increased balance, strength, and walking pace, built confidence and ability to be physically active, and improved overall health. Training to deliver active choices is available through the QTAC for systems integration partners. Active Choices is a 6-month duration, individualized and tailored approach to supporting physical activity efforts through telephone and emailed support. Trained coaches guide participants to create a plan to fit lifestyle preferences and resources, develop self-management skills around goal setting, problem solving, and building self-efficacy. The program also relies on self-monitoring, assessing social support, and preventing or managing relapse. There have been several studies of the effectiveness of active choices in randomized controlled trials and in translations in real-world settings with ethnically and economically diverse groups and groups of older adults with chronic conditions. Significant increases were found in moderate to vigorous intensity physical activity, total physical activity, satisfaction with body appearance and function. There were also decreases found in body mass index, or BMI. With support from the Centers for Disease Control and the New York State Department of Health, there is a major effort in New York to build capacity in the National Diabetes Prevention Program, or NDPP. In this program, a lifestyle coach works with a group of 8 to 18 participants to reduce their risk for type 2 diabetes by encouraging them to lose 5 to 7% of their starting body weight and increasing physical activity to 150 minutes per week. Weekly weigh-ins, self-monitoring of fat gram intake, and social support assist participant to meet these goals. Groups meet weekly for an hour for 16 core sessions, and then a minimum of 6 monthly post-core sessions to complete the year-long program. Strategies lifestyle coaches use to support change include leveraging group dynamics, facilitation versus teaching, self-monitoring of food, activity, and weight. This program is targeted to overweight adults aged 18 years and older with a BMI of 24 or greater who have been diagnosed with prediabetes, have a history of gestational diabetes, or have screened positive for prediabetes on the National Diabetes Prevention Program risk test. The CDC risk test screening is available on the QTAC website, which will be provided at the end of this module. To meet CDC requirements, no more than 50% of participants should be enrolled on the basis of the risk test alone. The intervention is based upon a large multi-site randomized controlled trial that compared the lifestyle change program to medication and education materials only and several follow-up translational studies. The lifestyle intervention sharply reduced the chances of developing type 2 diabetes by 58%. For participants age 60 plus, the reduction of risk was 71%. The metformin or medication group also reduced their risk, but not as much as the lifestyle intervention group. Another supported program is A Matter of Balance. Although A Matter of Balance is not one of the programs formally supported by NYSOFA and the New York State Department of Health, the QTAC may be able to provide assistance to partners with this program. A Matter of Balance offers practical strategies to reduce fear of falling and increase activity levels. Participants learn to view falls and fear of falling as controllable, set realistic goals to increase activity, change their environment to reduce fall risk factors, and exercise to increase strength and balance. The program is offered as 8 sessions led by volunteer lay coaches and meeting weekly or twice weekly for 2 hours per session. They are supported by a master trainer. A Matter of Balance targets people who are 60 and older, ambulatory, able to problem solve, concerned about falls, and interested in improving flexibility, balance, and strength. Program activities include group discussion, problem solving, skill building, assertiveness training, exercise training, sharing practical solutions, and cognitive restructuring, which is a process of learning to shift from negative to positive thinking patterns or thinking about something in a different way. In the reported studies, 97% of participants were more comfortable talking about fear of falling. 97% felt comfortable increasing activity. 99% planned to continue exercising. 98% would recommend A Matter of Balance. Although not directly supported by QTAC, there is strong encouragement for the adoption of caregiver programs, including programs for caregivers of people with Alzheimer's and other dementias. Systems integration funding may also be used to support these interventions. The next slides describe 4 examples of these interventions. The Savvy Caregiver program, delivered in 6 2-hour sessions, trains family and professional caregivers in the basic knowledge, skills, and attitudes needed to handle the challenges of caring for a family member with Alzheimer's disease and to be an effective caregiver. A detailed trainer's manual, a caregiver manual, a training videotape DVD, and a CD-ROM are available at the website provided for those interested in finding out more about the program. Resources for Enhancing Alzheimer's Caregiver Health 2, or REACH 2, is a multi-component psychosocial and behavioral training intervention for caregivers of patients with Alzheimer's disease or dementia. In randomized controlled trials and translational studies, the approach was found to reduce caregiver burden, depression, improve caregivers' ability to provide care and social support, and help caregivers manage difficult behaviors in care recipients. The content includes educational information, skills to manage care recipient behaviors, social support, cognitive strategies for reframing negative emotional responses, and strategies for enhancing healthy behaviors and managing stress. Strategies include didactic instruction, role-playing, problem-solving tasks, skill training, stress management techniques, and telephone support. The website is provided for those interested in finding out more about the program. The New York University Caregiver Intervention is a counseling and support intervention to improve caregiver well-being, delay nursing home placement of persons with Alzheimer's disease, mobilize social support networks, and help caregivers better adapt. Randomized controlled trial and translational findings support that participation in this intervention will help delay placement of the person with dementia in a nursing home. It has 4 components: 2 individual counseling sessions of 1 to 3 hours, 4 family counseling sessions with the primary caregiver and family members selected by that caregiver, encouragement to participate in weekly, locally available support groups, and ad hoc counseling or counseling by telephone to caregivers and families when needed to help them with crises and the changing nature of symptoms. The program is usually delivered by counselors with advanced degrees in social work or allied professions. NYSOFA and the New York State Department of Health are collaborating to work with Alzheimer's partners to make this intervention more widely available in New York State. The website is provided for those interested in finding out more about the program. Powerful Tools for Caregivers, a 6-week program led by trained leaders, helps caregivers develop self-care tools to reduce personal stress, change negative self-talk, communicate their needs to family members and healthcare or service providers, communicate more effectively in challenging situations, recognize the messages in their emotions, deal with difficult feelings, and make tough caregiving decisions. Class participants receive a copy of the Caregiver Help Book, developed specifically for the class. The website is provided for those interested in finding out more about the program. As you and your agency consider getting more involved in evidence-based programs, it is good to remember that there is support available through QTAC. QTAC functions as a backbone organization to support statewide scaling up and sustainability of evidence-based programs, and assists with training, increasing reach of programs, quality assurance, and purchase of materials. The QTAC also operates a statewide web-based registration and data entry portal to support many of the programs discussed here today. Again, QTAC directly supports the following evidence-based interventions: the Chronic Disease Self-Management Program, the Diabetes Self-Management Program, the Positive Self-Management Program, the Chronic Pain Self-Management Program. These are all part of the CDSME suite of programs. Also, the Walk with Ease Self-Directed Program, Active Living Everyday Program, Active Choices Program, National Diabetes Prevention Program, and A Matter of Balance. For agencies in New York, the QTAC Partner Portal supports provider and self-referral and access a project management and data management and reporting tool. It also helps with continuous quality improvement activities. Contact the QTAC to understand how you may become part of this EBI delivery system. To find out more about the QTAC and its affiliated evidence-based programs in New York State, visit this website, email, or call toll-free for more information.